although there is a lot of what they call in vitro studies, and there are many evaluations of how endo affects animals, there is very, very little data looking at natural products' effects on actual human outcomes. So there is nothing on live birth. There is nothing on, endometrioma sizes. There is nothing on the outcomes of lesion sizes or recurrence rates or fertility outcomes and things like that. So in our system, and I searched through PubMed today, we have very, very little data that can be extrapolated from cell culture studies or animal models like mice and rats and so on to human studies. Now, they've taken human endometriosis cells, in many cases transplanted them into rats or mice, and then they're looking at them and saying, okay, the lesions get bigger or they get smaller or whatever the issues are, but they have very, very little that evaluates the outcomes in actual human beings or in surgical studies or in terms of live births and clinical implantation and pregnancy and miscarriage and so on. So I'm going to go through the data on what's available. I'll go through the different products that are available, but keep in mind there is very, very little human data. So while many of these products look promising, we're not actually going to be able to tell you ahead of time whether or not these work or do not work. So one of the first ones is curcumin. So curcumin is the active ingredient in turmeric, which is a common sort of spice or herb, and you can use that in your cooking, and you can actually take curcumin powder, and it works in an anti-inflammatory capacity very, very well. There are a lot of studies looking at the antimicrobial, antioxidant, and even anti-tumor properties of curcumin, and they do show significant benefit. So people said, well, if it's good in all these anti-inflammatory, antioxidant roles, and even as an anti-tumor agent, would it be useful in endometriosis? So there have been studies looking at this in vitro where they're looking at cell cultures, and there have been animal studies as well. So what they showed in a large sort of review study was that there was a reductive effect on the progression and invasion of endometriotic cells, so these are endometriosis cells, and on inflammation in animal models. So they said that the stromal cells, which are the cells in between the glands, from endometriosis could be taken and put in with curcumin, and you see a reduction in the chemical mediators of inflammation, which are called cytokines or chemokines, and that many different protein molecules that are critical to that inflammatory cascade, to initiating all of the adhesion formation, some of the things that lead to inflammation, probably some of the things that lead to interference with embryo implantation, were all down-regulated or decreased, and it was in a dose-dependent manner. That's important because when it's dose dependent, you know that it's the real deal, because it means that it's an actual correlated response with the agent that you're administering. So it's not just that you gave it and something happened, it's that when you gave more happened, when you gave less happened, which means it's directly related to the agent you're using. So curcumin looked like it was really important. Some of these products are things you'd probably be bored to tears with. One's called STAT3, the other one's called JNK. These are phosphorylation products that can actually have an impact on your inflammatory cascade. There's a bunch of other ones like NFK alpha, NFK beta. So there's a bunch of different products that can actually be affected. The next one they looked at was a active component of ginseng called Ginsenoside Rf. So this is part of what you get from ginseng. It's very common in traditional Chinese medicine. And they've shown, again, a lot of immune and endocrine effects of using ginseng in the human realm. There are clinical studies for this, not in relation to fertility, but in relation to many different things like cardiovascular health, sexual health, menopausal health, and so on. So the anti-inflammatory properties of ginsenoside have been examined, and they looked at taking surgically induced rat endometriosis, where they actually put endometriotic cells into rats, and then evaluated what happened to those the implants of the cells, because they can reopen a rat and look inside. Sorry to any of those of you who feel that's unethical, and sorry to the rats. In any event, they did show that the volume of the endometriotic lesions was decreased after you got ginsenoside. So if you're taking these ginseng products, the amount of endometriotic lesions in the rats was reduced. Again, remember, this is not in humans, it's in rats, but it did show a decrease. They also again looked at the inflammatory cytokines and chemokines, and again showed that these were decreased, especially expression of nerve growth factors, which are thought to mediate a lot of the pain that comes with your endometriosis. And so they're saying this may actually help reduce your pain, not just your inflammation and your infertility. So that has some promise. Again, we don't know anything about actual human studies in humans, but it does look like it may be beneficial in animal studies using human tissue in the animal. So very promising, but not hardcore data. So there's one study looking at one patient, which is just called a case report. I don't think you can even really call it a study. It's a combination of Korean herbs. The only reason they included it here is because this patient had an endometrioma. Endometriomas are cysts of endometriosis in your ovary. They are notoriously bad because they do a lot of damage to your ovary. They can reduce the function of the ovary, they can reduce your follicle count, your responsiveness. They're very pro-inflammatory. They cause a lot of inflammation and adhesion formation. And if you leave them, they do damage. There's good data that shows that if you have an endometrioma, your follicular count goes down, your AMH goes down, the function of your ovary goes down. And when you remove them, it can be even worse if you're not careful in the surgery. So there's a lot of data out there showing endometriomas are really a very significant problem. The interesting thing with this study was they put a bunch of different agents together. I'm not even going to try and pronounce them. I don't think anyone but a homeopathist could. Nevertheless, they've shown benefits in women that had menopause, inflammatory conditions, and even cancer. In this one particular patient, a 36-year-old woman with an endometrioma, it actually progressively shrank the endometrioma, and they showed that there was decrease in all of her symptoms, including pain, itching. I don't know why she had itching related to an endometrioma. They mentioned pudendal symptoms, and even some of the inflammatory markers like the CA125 level. It's a protein we look at in your bloodstream that is associated with endometriosis in many cases and other forms of inflammation. All of these went down while this patient was using this. So that was really interesting. So promising, no larger scale studies, but they suggested that this should be looked at. It's a bunch of different Korean based sort of homeopathy products. Alpha lipoic acid, palmitolate aniloamide, PEA, and myrrh have also been looked at for endometriosis-associated pain. These were not fertility studies, but they were helpful for pain. And this was actually quite a large multi-center study done by DeLeo et al. And all three ingredients are known for being very anti-inflammatory, pro-suppression of inflammation, and good for pain relief. So they studied this in relation to endometriosis and showed that there was very good reduction in pain, although there was no change in the size of the cysts of endometriosis. So this actually was looked at in terms of the actual patients because it was a clinical study. So they didn't show a reduction in the size of the endometrioma, but they did show that there was significant improvements in pain, sexual function, and pain with bleeding. So it's a good pain reliever, but no data on infertility. They also had another study which used NAC, N-acetylcysteine, which is a product we really favor and use a lot, in addition to alpha lipoic acid and bromelain. And again, those three together showed a reduction in endometriosis-associated pain during a 6-month trial. Again, none of these show that there is improvements in fertility, but they did improve the pain, and if you're improving your pain, you're reducing your inflammation. So hopefully that connection is there, that you're then improving the results as far as the fertility is concerned. We've talked about melatonin on the show. We now use melatonin routinely in our fertility patients, as long as it doesn't put them to sleep, because obviously it does make you sleepy. So melatonin has shown benefit in fertility. And here in studies of endometriosis, they've actually shown that receptors for melatonin are increased in the peritoneal tissue where you have endometriotic lesions, and it reduces some of the cell proliferation that comes along with endometriosis. So when endometriotic cells land in your pelvis and they stick, they start to grow and multiply, and the melatonin has actually demonstrated that it can reduce the impact of that and reduce the growth of the endometriotic cells and the number of cells that are growing. Now, they did specify that was observed even within 48 hours of taking the medication. So this is a relatively immediate effect. I would love to see this on a broader trial or a broader scale. It would be very interesting in particular to know if some of the benefits that are seen in fertility patients with melatonin are even more pronounced in the subgroups. So I may reach out to one of the authors that's done that study before with melatonin in fertility patients and say, hey, can you break it down based on subgroup analysis? Because maybe the endometriosis patients are the ones that are really benefiting from this. Omega-3 fatty acids you're all familiar with. Those are the DHA, the fish oils, for example. We recommend that to a lot of our patients. It's very good at managing inflammation. I actually did basic science research on omega-3 fatty acids and know that it alters chemical markers of inflammation, because those markers were associated with adhesion formation, and we were very successful in reducing those adhesion markers using DHA in cell culture study. So this study also looked at a few studies that had done that in regards to endometriosis. They said that omega-3 fatty acids did not help in terms of analgesia, so in terms of pain control, better than typical things like progesterone or Visan or any of those things that we use. But it still did help better than placebo in terms of pain. They did not, however, see an impact on fertility. It did not improve it. And so they're not sure if it's helpful in regards to fertility or not. There are some studies that suggest it is. In these two larger studies, they suggested it was not. So that's still a question mark, but there's certainly no harm to taking omega-3 fatty acids. And again, anything that reduces inflammation is likely to end up with a benefit for those patients. There's another product I'd never heard of before called scutellarin. This is a flavonoid, so kind of something that often comes out of soy products. They did not show that this was beneficial significantly even in mice studies. They said further data is necessary, so probably not really useful to take that yet. Then they looked at Curcumin, which is a carotenoid product, and comes out of saffron. So saffron is very common in my culture. We use it all the time in our cooking, makes everything go yellowy orange. They put it in the rice. So it's got very strong anti-inflammatory tendencies. They did show, again, in a mouse model, that proliferation and inflammation of endometriotic cells were reduced. They said the endometriotic lesions did not grow anymore once they were on this, and it helped to reduce some of the growth factors that cause the endometriotic lesions to grow. So they said they actually were able to stop the growth. There was inhibition, although they didn't see it actually kill the endometriotic lesion. So again, you might be able to prevent it from getting worse, but there's no data that these agents actually cause death or regression of the endometriotic lesions. And again, keep in mind this was in a mouse study. There's another product called 6-Shogaol. I think that's the one, the way to pronounce it. Major active ingredient of dried ginger. So if you like dried ginger, this is your thing. This was quite good because it showed a reduction in the size of the endometriotic lesions and significant downregulation of some of the cytokines and chemokines. So 6-Shogaol is potentially helpful. They found some effect on the formation of inflammation by lowering levels of some of the pro-inflammatory cytokines like interleukin-1 beta and interleukin-6, which is very pro-inflammatory, and even prostaglandins, which cause a lot of the pain that comes with your period and with your endometriosis. So again, all of these were fairly favorable, but again, in rats, nothing in humans. The last one that they looked at was taking isoflavones. So again, these are soy-based derivatives. If you're big into taking soy, so those are the tofu products. And they showed that it does inhibit proliferation and growth again. And they are very good at reducing inflammation, multiple markers, especially some of the ones that are involved in pain, including COX-2 and prostaglandin E2. So these are again markers of pain and inflammation, and these can all help reduce the amount of pain you get from your endometriotic lesion. Again, we don't know if this is helpful in terms of fertility specifically, but the theory would be if you're reducing pain, you're doing it via a mechanism that's reducing inflammation. If you're reducing the inflammation, maybe you're reducing the infertility. So, do these natural substances work to help endometriotic patients in terms of fertility? We don't know. The truth is that it looks like the chemical components of this can actually help, and they can reduce the outcomes in terms of inflammation, in terms of pain, and in terms of lesion growth. It looks like that's pretty ironclad now. There's a ton of data demonstrating that it's beneficial there, but there is not any real good data showing that the fertility outcomes, live birth, reduction in miscarriages, implantation, or clinical pregnancy are actually improved. We need a lot more work before we can get to that stage. Nevertheless, anything that reduces your inflammation is always good from a fertility perspective. So am I a believer? I think it's a fact. These products have a lot of hope, but there is no data to demonstrate they are clinically active in terms of improving your fertility outcomes. So you still need to focus on some of the more traditional medications that we use, like Lupron, like Visan, or taking surgical approaches, therapeutic approaches like that, and then use these to also help you as an adjunct. Never go into it just with these alone. It will probably not be sufficient to suppress all of what's going to happen to you if you have significant endometriosis. So thanks again for joining us for the fertility fact or fiction component of our show. Make sure you subscribe to our YouTube channel, like, share, comment. That's always really important for us. We're going to go to the questions now, and don't hesitate to put up your questions on any of the platforms, on YouTube, on Facebook, or on Instagram. We can get them all. So thanks again for joining us for that first part, and I guess I'll start taking questions right now.